Vaccines to protect against the coronavirus are finally here, and shots are going into arms. The rollout started right before the holidays with shots for healthcare workers and residents of long-term care facilities. Federal health officials say the general public should be able to start getting vaccinations by late February and into March. So when a COVID-19 vaccine becomes available to you, how do you know if you should get it? Let's break it down. So far, 2 coronavirus vaccines have received emergency use authorization in the United States. The first one is Pfizer. It's 2 shots given 21 days apart, and it's recommended for people who are 16 years of age and older. The second one is Moderna. It's also 2 shots, but they're given 28 days apart, and it's recommended for people who are 18 years of age and older. Research is being done to see if coronavirus vaccines are safe for children and younger teens. If you've already had COVID-19, these recommendations don't change for you. You should still get the vaccine because the immunity you got from being sick might have waned. If you're currently sick with COVID-19, you should wait to get the shot until you've recovered. If you're part of one of these recommended groups and you're also a pregnant woman, you can still choose to get the vaccine. But you should know that these vaccines were not extensively studied in pregnant women, so there's limited safety data to look at for that group. On the other hand, COVID-19 itself poses a risk for pregnant women. The CDC says that some women who contract COVID-19 are at an increased risk of severe illness and might also be at an increased risk for having a preterm birth. A discussion with your doctor can help you make a decision that's right for you. Consider how much virus is spreading in your community and what your personal risk of contracting the virus might be, depending upon your job or other activities. If you're part of one of the recommended groups and you're also a woman who's nursing your new baby, you can still choose to get the vaccine as well. Both Pfizer and Moderna are mRNA vaccines, which are not thought to be harmful for a nursing child, according to the CDC. If you're part of one of the recommended groups and your immune system is compromised, you can also choose to get the vaccine. But you should know these vaccines weren't substantially studied in immunocompromised people, so there's not enough data on how safe they are or how effective they are yet. On the other hand, getting infected with COVID-19 can be risky for people with compromised immune systems. A discussion with your doctor can help you make a decision that's right for you. Consider that your immune response to the vaccine might be reduced. Allergic reactions to vaccines are generally pretty uncommon. Anaphylaxis, which can trigger a rash and trouble breathing, for example, only happens in about 1 out of every 1 million doses. That said, the CDC says you shouldn't get the shot if you're allergic to the components in these vaccines, which you can review on the vaccine's product labels. If you have common allergies, for example, to certain animals or foods, the FDA says you're no more likely than the general public to have an allergic reaction to these coronavirus vaccines. And so, if the vaccine is recommended for you, you should get vaccinated.